Here we are with video number 2 for NRP guidelines, working with correction action steps of Mr. SOPA. This is our baby. Our baby was just born and placed on the radiant warmer. We're going to notice that the baby is either apneic or gasping, or has a heart rate less than 100, which would indicate the need for positive pressure ventilation. Paige has chosen the number 1 size mask, which appropriately fits the baby's face, and will attempt to deliver a positive pressure breath. After 5 breaths, it is noticed that the chest wall is not moving. Now we're going to decide to work through the Mr. SOPA correction action steps. The first part of Mr. SOPA is the MR, which is the mask adjustment and reposition of the head. Reattempt to ventilate, looking for chest rise, and we're noticing a slight bit of chest rise. So if that were a real situation where the chest wall is now moving, we're going to ventilate for an additional 30 seconds, paying attention to our heart rate, hoping that it's on the rise. If the chest wall were not moving, we would move on to the second correction action step, which is SO. So we're going to suction the mouth and nose and open the mouth. Reattempt to ventilate. Looking for chest rise. After 5 breaths, if chest rise is not noted, we're going to move on to the next step. The next step would be the P in Mr. SOPA. So it is going to be a pressure increase, and I'm going to move that peak inspiratory pressure. Go ahead, Paige. From 20 to 25 for a pressure increase. We're going to attempt to give another 5 breaths, looking for chest rise. If chest rise is not noted, we're going to move on to the last step, which is A in the Mr. SOPA, and that's your alternative airways. That can be your OPA, your LMA, or your ET tubes.